My name is Ayana Davidson, and I'm going to be informing you about the risk associated with cosmetic procedures, along with the costs and the ages of people getting procedures done. I think most of us have heard that saying, if it's not broken, don't fix it. But that hasn't stopped millions of people from getting cosmetic surgery done each year. I chose this topic because my major is nursing, and I think it's very important for people to know the risk associated with every procedure they're having done. Cosmetic procedures affect families every year and every day, and it's on a steady rise. And more people should be informed about the risk associated with the procedures they're having done. Now you may ask, who is getting cosmetic surgery done? Well, every group in every age range is getting cosmetic surgery done, and it affects most age ranges 13 to 19. Women who are age 19 are getting breast augmentation, and the price can range from $3,000 to $6,000 for implants and $13,000 for the procedure, according to the AmericanPlasticSurgery.org. Risk of the procedure are rejection of implants and infection. The most common cosmetic procedure that is for age ranges 13 to 19 are rhinoplasty. Rhinoplasty is common because when you're ages 13 and up, you're playing sports. Sports such as soccer, softball, baseball, cheerleading. And those sports can inflict risk on your nose. When your nose is broken, it causes your septum to deviate. And the price of rhinoplasty can cost anywhere from $3,000 to $10,000. The risks associated with rhinoplasty are staph infection, which can cause the septum to deviate again and heal crooked. Rhinoplasty and breast augmentation are some of the most common forms of cosmetic procedures and pose some of the more risks to younger people, per the Atlantic Health Solution. Let's now see what people in their 20s are doing. Common surgeries for older ages and the risk they pose would be liposuction and tummy tuck, which affect ages 20 to 29. Due to some people wanting to use liposuction as a quick fix, it is one of the leading procedures that causes the most infections. Infections such as gangrene, and it can affect the organs and your brain due to the infection. Tummy tuck is the second most common procedure when it comes to body reconstruction because the skin holds one of our largest supplies of blood. And when you remove that supply of blood, it can cause the skin to die. 12,000 people receive tummy tucks every year, and around 40,000 people underwent liposuction. Now that we know the risk associated with tummy tucks and liposuctions, let's see what age groups 30 to 50 are having done. People who are 30 and 50 years of age, up to 30, 50 years of age, are having Botox, facelifts, and dermabrasion, which can range in price from $3,000 to $50,000, depending on which one you're getting done. Botox is when you insert a neurotoxin underneath the skin, which causes the muscle to freeze in place. The risk it poses is that your face could be stuck like that, or in any shape or position that you're holding it in for up to 2 weeks, in some cases. The risks that are associated with dermabrasion will be bruising and fungal infection. And for people who get facelifts, it can cause your skin to crust around the scars and even cause your facial skin to die. That's according to the MayoClinic.org. Now that we've learned some of the common plastic surgery procedures people in their teens, 20s, and ages 30 to 50 get done, procedures such as breast augmentation, rhinoplasty, tummy tuck, liposuction, Botox, dermabrasion, and facelift, knowing the risk of these procedures will help people think twice if this is really what they want done. If somebody wants plastic surgery, then it's more power to them. But I think everyone should know the risk associated with the procedure that they want done. This chart shows the people who are getting rhinoplasty and breast augmentation, people who are having liposuction and tummy tucks, and the people who are getting Botox, facelifts, and dermabrasion, which is a very large portion. So everybody, please be sure to learn the risk of the procedure that you're wanting done. And even if you're not having the procedure done, be sure to inform somebody else about the procedures they're having done.